Based on what businesses across our city tell me, more help is needed. Every mayor across Metro Vancouver agrees small businesses are reeling in our communities, and I reiterate our joint call for the Minister of Municipal Affairs to expand the existing provincial property tax deferment program to cover all businesses and nonprofits. That would provide immediate relief without putting municipalities in any additional fiscal difficulty. More work also needs to be done at the federal level to help businesses and nonprofits struggling to pay rent. Many business groups, including Vancouver's Business Improvement Associations, say the Canada Emergency Commercial Rent Assistance Program is not working as well as it could. Many landlords will not apply for it, and many tenants are not eligible for rent relief. Already, we have seen the federal government's willingness to make adjustments to programs to make sure aid is getting where it needs to go. So I'm calling on them to do better on commercial rents, including extending the program to include municipalities. So that's it on my update, and I'm happy to take questions, but first we'll hear from Dr. Daly.
Thank you, Mayor Stewart. It's my pleasure to be here to give an update on the COVID-19 outbreak here in Vancouver and Vancouver Coastal Health. And the first thing I would like to do is to thank the citizens of Vancouver and of the broader region for all the great work that they have done to help us flatten the curve on the outbreak here. We flattened it more successfully than many other jurisdictions around the world, and that's because you have followed public health recommendations and guidance, staying home if you're sick, frequent hand washing, maintaining physical distancing. So that's good news. Now in British Columbia, we are at the lowest levels we are likely to see for COVID-19. The risk in the community that you'll be exposed to it is very low, but the virus is not going to disappear. So that's important because we still need to follow the guidance of public health officials as we begin to reopen society. So just to give you an update on where we are within our health authority, since the beginning of the pandemic, we've reported now 898 cases in Vancouver Coastal Health. The vast majority of those cases have now recovered. Of those cases, 19% have been hospitalized and 7% have been admitted to our intensive care units. 10% or 86 cases have died, and my condolences also go to the families of those who have died. 2/3 of our deaths have been among residents of long-term care facilities. And we know, and this is not just here in our region, but across North America, that frail residents of long-term care are at the greatest risk for severe COVID-19 deaths. And we have had to deal with a number of outbreaks in our long-term care facilities, although we, because of some of the interventions that we've put in place, we have done better than other jurisdictions. But just to give you an update, in Vancouver Coastal Health, in total, we have declared outbreaks in 13 long-term care facilities. Now, we have a very low threshold for declaring an outbreak. We will declare an outbreak even with a single case among a staff. Of those 13 outbreaks, only 8 had cases among the residents. And we've had a total of 55 deaths in those facilities. Many of the outbreaks have been declared over. We have 6 remaining active outbreaks in long-term care, but amongst those outbreaks, we haven't had any recent cases. We do not declare an outbreak over until 28 days have passed since the last active case. So most of those outbreaks now are waiting for that period to expire. We're monitoring, and we hope that we will soon be able to declare them over. We've had 2 outbreaks in acute care facilities at Lionsgate Hospital and Richmond Hospital. Those outbreaks have also been declared over. Some of the good work we've done in long-term care, we have worked with the operators of all of our long-term care facilities to ensure that they have heightened surveillance for any staff member or resident who might have even mild symptoms of COVID-19, and we initiate testing in those cases. All staff who come to work at those facilities are screened before each shift to see if they have any symptoms. We've provided personal protective equipment, PPE, to all the staff in long-term care. This includes masks, gloves, and eye protection. That's not only to protect the staff members, but to prevent them from exposing residents to COVID-19 if they are infected and may not be aware of their infection. And we know that the outbreaks that we've had, the virus has been brought in, often from staff, many who didn't realize that they were infected. We have a rapid response team when we do have an outbreak in a facility that includes public health staff, highly skilled infection prevention and control staff, and operational staff from the health authority. And we go in and we assist any facility, whether it's one that we operate at Vancouver Coastal Health, private facility, one that we fund, to ensure that we have a very good rapid response to contain the outbreak. And so we think that's really helped us. Now, going forward, this is the perfect time to begin to reopen because we know that the COVID-19 outbreak has had a devastating effect on many people in our communities. They've lost their livelihoods. The businesses that the mayor referred to have struggled as we've put in place public health measures. Many have closed under public health order. Many more actually closed voluntarily. Now is the best time to begin the reopening because our levels are so low. And the province has a very, very sensible plan for reopening. We're now in phase 2. WorkSafe BC has developed very good guidance for businesses as they reopen. Public health officials have helped in developing that guidance and will help facilities as they start to reopen. So in phase 2, many of those facilities that were closed under public health order are now reopening, restaurants for in-restaurant dining, personal service establishments, and others. And we continue to support other businesses and sectors that closed voluntarily that are reopening. And I'm pleased to see that among those are some of our outdoor spaces in the city, parks, for example. Children's playgrounds will be opening as of June 1st. We support all that. We also support children going back to school in the month of June, and the province has developed very good guidelines for schools and for daycares. Daycares were never actually closed. We encouraged them to stay open throughout the pandemic. Schools have also provided some support for certain students during the pandemic, and now parents do have the option, and you can check with your local school district, of having your child return to school in June. We actually would encourage parents to do that because we don't want to wait till September when all students are likely to go back. We want to give schools, boards, and schools the opportunity to work through their new safety plans in the month of June. And so I would encourage you to check with your local school board and to send your children back to school based on the guidance that you get. Now, for those who may be concerned as we start to reopen, even though the risk is very low right now and we're seeing very few cases, and most of the cases we are identifying now of COVID-19 are either returning travelers or people who've had a known contact to another case. So we're seeing very few cases of so-called community transmission where we can't identify the source of infection. Even though that's the case, we know that people may be anxious, either about sending their children to school or about businesses reopening, those people who may be working in these businesses. So just to give you some reassurance, as we reopen, we are going to be carefully monitoring to make sure we don't see a resurgence in cases. We have ample capacity to do testing for COVID-19 in British Columbia. In fact, we offer universal testing. Anybody who needs a test can get a test, and we recommend that everyone, even with very mild symptoms of COVID-19, should go for testing. And you can contact 811 for a testing site near you. We don't recommend that people without symptoms get testing because the test is not reliable in that situation, but certainly lots of testing capacity for anyone who might need it. And right now we're seeing a very low rate of positivity in those people who are tested. We're actually less than 1%. So this indicates that there's not a lot of COVID-19 right now in the community, but also that we're doing robust testing. We also have public health capacity to immediately follow up any new case and identify the contacts. And for any case of COVID-19, those cases will be under isolation until public health deems that they're no longer contagious to others. And contacts are asked to quarantine for 14 days after their exposure, and they're monitored on a daily basis. If they get symptoms, they are tested. After 14 days, if they haven't developed symptoms, they're released from quarantine. We still also are requiring travelers who are returning from outside Canada to quarantine for 14 days. We do have some travelers from within Canada, and we have had some cases of COVID-19 that have arisen in other places in Canada that we've identified here. But the good news is our surveillance system is picking up these cases, we're containing them, and we're able to follow them up. So I'm hoping that will give some confidence to the public as we continue with our reopening. I really support the efforts of the city to try to support businesses in the city to reopen. And just to say, Vancouver Coastal Health public health staff are also here to assist you, our health protection staff. For example, we have developed some really nice online checklists that small businesses, small restaurants, or personal service establishments can use to ensure that their plans are consistent with the WorkSafe BC guidelines. And those will be available on the Vancouver Coastal Health website. We're also here to answer any of your questions, but what we have found is that the business community has done a really good job about ensuring that when they do reopen, they're following WorkSafe guidance. They're doing so in a manner that both protects the public and protects their staff. So happy to answer any questions, but before I do, I just want to mention the other public health emergency going on in the city at the moment, which is the the opioid overdose public health emergency. And just to remind you, because we had a recent release of new coroner's data from the month of April, that we did see an increase in overdose deaths in the province in the month of April. This was across the province. In Vancouver, there were 32 reported deaths. That's the most we've had in many months. And that's concerning to us. It's about double what we were seeing in the months at the end of 2019 and early 2020. I've said this before, that the opioid overdose emergency is the more serious public health emergency in the downtown east side of Vancouver, where we haven't had any COVID-19 outbreaks, and yet people remain at risk of overdose death. We are concerned because we are seeing fewer people using the overdose prevention services that we have available down there. Visits to those sites did drop at the beginning of the COVID outbreak, and they have not gone back up to their pre-COVID levels yet. So we encourage everyone, don't consume substances alone. Go to an overdose prevention site or a supervised consumption site, and to take the appropriate precautions, because that remains a concern. And we will continue, for example, to implement our new guidelines for providing prescription alternatives for people who are at risk of overdose death, with the new guidance that's come from the provincial government. That's several hundred people have benefited from that option at the moment, and we want to continue to address that public health emergency as we will, of course, continue to respond to COVID-19 as well.